Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today I have with me Dr. Sanghee Hong, Assistant Professor of Medicine at Duke Cancer Institute, one of the leading transplant centers in the United States. And she's going to walk us through how she decides on various aspects of stem cell transplantation. Welcome, Sanghee.
Thank you so much for inviting me today for the talk today.
So we're going to get started, and I would say that obviously, generally, two broad buckets of transplant: autologous and allogeneic. How do you decide who to give an autologous transplant to and who an allogeneic?
Yeah, so that's actually the first question most patients ask as well, and then also the community oncologists too. So when we give autologous stem cell transplant, the purpose of doing it is to give the stem cell rescue after high intensity conditioning chemotherapy for the patients with a hematologic malignancy such as multiple myeloma or lymphoma, although it's less used. And for the allogeneic transplant, it actually serves different purpose of replacing the patient's immune system to someone else's to induce what we call it as a graft versus tumor effect. So when we consider for the cancer that we think that we'll be able to cure with the high intensity chemotherapy or be able to prolong their next time to the progression, then the goal is to give the autologous stem cell transplant with a high intensity chemo followed by their own stem cells. If we believe that patients need more than just chemotherapy to get to that potential for cure, then our goal is to give conditioning, which can be chemotherapy plus or minus radiation, and followed by the donor cells, then that is the allogeneic transplant.
So, what disease states generally? I know there's an overlap over here to a large extent, but broadly, what diseases do you go for an auto over an allo and vice versa?
So for now, the biggest indication for autologous stem cell transplant is multiple myeloma, followed by wild